the presentation of ARFID can be complex and it is highly individualized. We see a lot of co-occurring diagnoses with ARFID, such as ADHD or autism, OCD, anxiety, or depression. You might be more at risk of developing ARFID, for example, if you have experienced a traumatic experience during childhood, if you have been a picky eater or had more severe food aversions during childhood that have led to develop into adulthood. It also might be another coexisting eating disorder or disordered eating. One other risk factor might be due to different experiences a person might have. For example, if they experience severe digestive issues or pain or bloating, that might create aversion to eating, or a person might have a choking episode or some other traumatic experience during childhood where they then develop certain fears or aversions around certain types of foods. A person might have an underlying condition such as a neurodivergency, ADHD or autism, which might increase a person's anxiety, or sensitivity to different sensory textures, or that might be sound or taste, or even the way that food might feel. Complications for ARFID are very individualized, and sometimes it might be that we can't see some of the consequences that are occurring for someone living with ARFID. So for example, a lot of these consequences might be internal changes, such as changes to the digestive system due to malnutrition. Also along these same lines, it could be developing osteopenia or osteoporosis, cardiac changes, loss of menstrual cycle. So a lot of those physical changes that can be tied to living in an undernourished or malnourished body, and the body not getting enough energy.